should veterans use VA healthcare, which is a totally different topic outside of what we just discussed. But this one's almost, there's no poll. All right, I'm sorry, there's no poll. But I would argue there would be a higher no than a higher yes, just from reading comments about VA healthcare. And as far as healthcare goes, this is, I'll speak on my experience, my personal experience. VA healthcare for me has been really good. I would probably say like 8 out of 10. There's definitely some things I would fix. The appointment times are really getting on my nerves at this moment. Right now, actually, I just made an appointment this morning. Try to. The wait times are a little out of hand. But as far as VA healthcare, for healthcare purposes, I think every veteran at a minimum should enroll and speak with their primary care. I think that should be the standard. Every veteran should have a relationship with VA healthcare. The VA secretary, I said that many, many times. And whether you like the VA or hate the VA, I still believe everyone should be enrolled in VA healthcare at a minimum. I have so much more on that, Jason. I want to kick it over to you. Should veterans use VA healthcare?
All right. Just a warning. I have hens that are laying eggs, or a hen that's laying an egg, and then they all jump in as a support. So you might hear that in the background. I'm going to push through like it doesn't exist. They're quiet now for a second, so we'll see if it jumps back in. All right, so yes, absolutely. And here's the couple different reasons. It doesn't matter if you're seeing a private doctor somewhere else, you should also go sign up for VA, right? So that's the number one thing. And here's my kind of, it's kind of twofold, I guess. One of the reasons is if we don't show a demand for a service, that service goes away. That's just business, right? So if all of a sudden no veterans are signing up for VA healthcare in your backyard, right, they will close that down and move it to where people are using it. So that is a real thing, and you need to be aware of that. And here's the other thing. If you don't go there, and let's say you go twice a year, right? If you go twice a year and you stop by the little snack shack or whatever they have in there, right? The more you use that, the more options they will have later, because they're actually bringing in money. It's all like business. It's all work, right? So it doesn't just magically appear there with everything that you want without the demand, right? You have to have the demand. So that's one piece, right? Because look, no matter how much we love or hate the VA, right? That option will go away in your neck of the woods if it's not being used. Just want to throw that out there. The other piece why you want to go utilize VA healthcare is especially if you have conditions that have future exams. Now, is it a requirement? Not necessarily, but it's a lot easier if you go there for those conditions and be seen and get it documented all under the VA umbrella and keep that kind of track going. It's just a smoother process as you're trying to maybe either one of two things. You're either going to heal, which is usually not the case, or it's going to become static, right? You're showing that it has not improved over a 5-year period, and maybe you're going to have that next exam that solidifies that, and they'll move that condition over to a static designation, which is important on your trip to 100% permanent and total, where you can then go get your DV plate. And if you live in Virginia, you get to decide whether you want the blue cube or not. Yeah. Which is great. So I think that really the two things for me is, one, making sure that you're documenting what you need to document on those non-static conditions where you might have a future exam. And then two is, look, I don't mind the VA. I've had shitty private doctors and I've had not so great VA. I mean, it doesn't really matter where, it's a people thing, right? Overall, the VA has been as good or better than any private doctor I went to. And I like the environment a little better because I know that I'm surrounded by a bunch of veteran patients in there, and you can just kind of look at each other and have a conversation. I mean, with any of them, be like, well, this sucks. Can't believe I'm sitting here, or whatever. Right. I mean, you can have those little kind of, little head nods and you know what you're saying. Right. And it's I don't know, that part's a little bit comforting, instead of walking into some private doctor somewhere. So that's my take on that, Clay.
Oh yeah, as far as the disability side goes, it comes down to one word, and that's evidence. Whether it's for a re-exam, an increase, a new claim, a supplemental, I don't care what kind of claim, it comes down to evidence. Can you use private for evidence? You absolutely can. And if you have that option, because it does cost money, go for it, right? But VA healthcare, if you're rated 50% or higher, no cost, no co-pays. Doesn't matter if you're rated for that or not. At 50% and higher, your healthcare is free. Now that's for you, the veteran. Yeah. And so it's that alone, there's a monetary benefit for that. But for disability, it comes down to evidence. I had mentioned migraines earlier, about the veteran telling the other veteran about how to get evidence. It's one thing to tell the C&P examiner, hey, examiner, I get 4 to 5 migraines per month. It's a whole other thing to say, hey, examiner, I have prescribed medication, sumatriptan at 100 milligrams. I've been taking for 6 months. I have 2 prescription refills. And so let's say one refill is 15 pills. You can do the math. And so now instead of you having a self-report of your frequency and severity of migraines, right, you have hard medical evidence that can't be refuted. And even if, because it's totally probably going to happen, to be honest with you, even if the examiner does a poor job at completing the DBQ, you have the HLR process because you have the evidence. If you don't have the evidence, that HLR, higher level review, is gone. You're now into the supplemental claim realm, and supplementals are difficult. Right? They're absolutely difficult because you need to submit new and relevant evidence. Hence, go to VA healthcare. I am 100% for VA healthcare. And a side note, I wasn't really going to talk about this, but whatever, I'm feeling it right now. Outside of disability, I think healthcare for veterans is exponentially more important than your average civilian healthcare. I can't stress that enough. I'll just talk about my peer group because that's what I know. But like the post 9/11 generation, I can tell you that my friends need healthcare, and I can just look at them and tell you, brother, you got to take care of yourself. Taking care of yourself. I'm 31, by the way. Okay. Taking care of yourself is extremely important because when I am 40 or 50 or 60, like Jason's age, that's a joke.
I'm 50, not 60.
When I am that old, I want to be able to play with my kids, do this, do that. I don't want to be old and broken, and I just can't. I mean, healthcare is extremely important, and I can't stress that enough. I mean, I don't even know how else to say that. Go
right.
Go, Jason.
You know what? I think that you do bring up a good point. Now I got to show that I have hair at 50. All right. So
more hair than I do, dude. Look at that.
So it's it's that Chick-fil-A, man. Don't eat that Chick-fil-A. Make you lose your hair. All right. So here's the thing. And this is important. Number one, VA healthcare is a huge monetary benefit because you're not paying for it. Okay. And when you get to the point of you don't have any insurance, you're retired or whatever it is, you're not working, that is gigantic. Do yourself a favor and go on to a medical insurance website and see how much it would cost to cover you at your age. Play with the numbers, make yourself be older, and see how much medical insurance costs for a premium plan, something with no copays, something that's, the Cadillac plan, right? So it is worth a lot of money. These plans or whatever, the VA healthcare. The other piece is that the VA, and this isn't really talked about enough, the VA healthcare system is the largest in the nation of a healthcare network, right? It's huge. They also have clients that are all veterans. That's important. Why? Because they are keeping data on all of us and seeing, okay, here's these issues rising here, here's these issues rising there, this is happening here, right? Doing all their nerdy mojo in the background to ideally help figure us out, right? Which is important, right? So they have this repository of information and they're running all these things. They do that in the background constantly. So here's another piece that I like to throw out when it comes to healthcare, especially anybody who has served in any location that has presumptives assigned to it. Okay, if you have service in any location that has presumptives, doesn't matter if you have one of them, right? You have no issues, none of those conditions. Oh darn, right? The reality is that you are more likely to get one of those shitty conditions. The VA knows that based on the information they have on you, and they're going to kind of keep an eye on that. You would think they would keep an eye on that a little more, but you should also be having that conversation with your doctor, right? As a gentle reminder, hey, look, I know that really I should be screened at age 50 or 60 or whatever for this type of a condition. However, because I served in that location, I'm more apt to having that condition, a horrible cancer or something. Maybe we could test that a little bit earlier. I'm just saying, because I'm more likely to get it than anybody else. So it's just my way of thinking. And I think it's probably, I don't know, an ounce of prevention, right? So anyway, back to you, Clay.
I 100% agree. I couldn't agree more, actually, Jason, especially with the data. You know, I've said this a few times, and I'll always say it. The reason that Gulf War era and post 9/11 era have the PACT Act is because Vietnam veterans got shafted. Like, that is the only reason that was pushed. And it's through data, it's through VA health. It's a ton of things that are really way over my head. But you are 100% right. And I think everyone should be grateful to Vietnam veterans specifically for the PACT Act, because they got, they're still getting shafted right now as we speak. But I'll kind of get off that box because it's not good.